All right, welcome back to the Myopia Mindset. This is the podcast full of inspiration, education, and motivation to help you on your path towards success with myopia management. And my guest today is Dr. Andrew Brauer. He is an orthokeratologist practicing at Eye Care Center of DuPage and serving the greater Chicagoland area. Andrew, welcome to the podcast. Thank you for joining us.
Thanks for having me. This is a real pleasure. It's always a pleasure to get to talk to you. This is the first time we've ever recorded it, so we'll see what happens. I'm really looking forward to it. And actually, you know what, Matthew, if I could, may I just start off saying thank you to you. I have listened to all of your episodes here in this Myopia Mindset series, but I've also listened to all the other ones you've done over the years for the AAOMC, and just absolutely fantastic. I've heard it said, and I think it's generally true, that innovations in eye care and healthcare and medicine take about 17 years to become mainstream. And I really think you deserve a lot of credit for getting a lot of information out, for educating a lot of people, and really shortening that window. So if you don't mind, let me say thank you for all that you've done for this industry, not just with the podcast, of course, with the organization and everything, but I really do appreciate it. And I feel like even though you and I have known each other for a few years, I in a way, I feel like I've known you for a lot longer because of all the content you've put out over the years. So thank you. And I'm very happy to be here.
Andrew, thank you so much. I don't know what to say. I appreciate that. I am flabbergasted here. I don't know. I don't know how to continue. I was not expecting that, but thank you so much for your kind words. And I definitely, we've had some great conversations over the years, and that is definitely what I want to be the focus of this particular episode, because I feel very fortunate to have met you. And then also we have had great conversations around your development in myopia management, figuring out what your identity is. And I want to harken back to a conversation that we had when you had first purchased the practice that you're in now as part of that process. But let's kind of start at the beginning. Tell us about your practice. And, ever since I interviewed Glenda Aleman, she talks about how every myopia management specialist has their special ingredient. So I want to talk about what yours is. So tell us about your practice and what's important to you and what you bring to the table, and how that translates into orthokeratology and myopia management.
Yeah, absolutely. Certainly, I'll get to my practice specifically, but I think in general, possibly the most important things that you can give to somebody are your time and your attention. And I think that, there's so much about myopia and Ortho-K specifically that you cannot rush it and do a good job. You cannot shortchange somebody on their time and do a good job. And to me, like a lot of us, this is our career. This is what we care about. And it's really important to me to do an excellent job. And unfortunately, there's just so many forces in our industry that, want us to take less time with patients, want us to make it quick, want us to see more patients in less time. And so eventually it just came to the point where, I wasn't comfortable doing that. And I didn't feel like I was really doing the kind of job that I really needed to do to be satisfied with things. And so coming up on a year and a half now in the practice that my wife and I bought. My wife's also an optometrist, and it's been really fun to work with her professionally for the first time. And the practice that we bought is, it's got a great patient base. It's got a great core group of Ortho-K patients. The previous owner was really a lot like Carrie in some ways, really a trailblazer, has been doing this a lot longer. He was doing Ortho-K before it was cool. And for that reason, we're really blessed to have patients that have been in it for multi-decades, which is not something a lot of practices can say. We have Ortho-K patients from coast to coast in the United States coming to see us. We have Ortho-K patients coming from China to see us, and a lot of other places. And that's just such a cool thing to me. I can't take credit for all that, but I'm thrilled to be a part of it and thrilled to pick up the baton and carry it through this next phase. Um, Certainly there are plenty of, background things that we've been working on updating, but man, really at the bottom of it all, it's just a joy to be doing what I really love and to be doing it at a level that I think is, acceptable to me. And I think our patients really appreciate that too. So it's been a blast so far. We're still new to it, but really loving it and not looking back.
Yeah, and that is a tall order to take on an existing Ortho-K practice with patients who have already been in treatment for a huge chunk of time. They come from, like you mentioned, a trailblazing doctor, and they are used to a level of care and have high expectations. That's one of the things about myopia management patients is they require extra time. They require, a higher standard of care, and then they have the expectations that come with that. And I love that that's a core fundamental aspect of who you are as a practitioner. It's something that is on your website about how, you want to make sure your patients understand that you are going to spend time with them, that they are not going to get rushed through the experience. Is that something that you were facing previously in eye care and practice, like out of optometry school? Because that tends to be the norm, right? Like I've been in so many practices where they're like, I'd love to not cut these corners with things like topography capture and spending time with the patients that they need, but they just don't have, that's not part of the model as a whole. So, I mean, is that what you came up in that environment? And is that what then drove you to this viewpoint?
Absolutely. And to that standpoint, I know it's a hotly talked about topic that, should everyone do myopia management? And I do not think they should, or at least not. I think they should know their limits and, maybe take the easy cases and pass the rest on if they need to.
Right.
Because it's, I don't want to discourage any particular modality of practice. There are absolutely high volume medical practices that do things really, really well and see a lot of patients. And that's great. I don't want to say that that's the wrong thing to do. I don't want to discourage that. But for Ortho-K specifically and myopia management generally, I just don't think that model works for this. And because that's what I'm interested in, I just don't see myself fitting in that other modality quite so well. And so I also don't want to suggest that I've got everything figured out. This is a work in progress, and we're trying new things and experimenting all the time. I'm fortunate to have a wonderful team. Our office coordinator is just super experienced beyond her years and super great with patients and really embodies the kind of personal touch that we really look for. And so, at least for myopia management, at least for Ortho-K, I think that, the situations that I was in previously just weren't that conducive to that. And, I'm not really okay with doing an okay job. I really want to be excellent when we're talking about, these types of things. And so I think the kids deserve it. And truly, more and more, we've been doing adult Ortho-K, which is, I think, a really cool thing as well. And the adults deserve it too. And the adults will demand it, which is great as well. It keeps you honest. The kids are like, yeah, everything's great, whatever. But adults are pretty demanding. And that's actually a big part of something I love about Ortho-K as well.
Right.
I hope that answers the question.
It does. Yeah. I always think it's fascinating because, I grew up in a pioneer Ortho-K practice. The first cases that were done back then, were on policemen and pilots and kids who were swimming, primarily like, athletes and whatnot. But the core of that beginning was adults. And now we're in this era where, people who do Ortho-K are usually kids, right? Our patients are usually kids. And then you have the parents who are like, could I do this? And you have a lot of practitioners who are squeamish about fitting adults. did you experience the same kind of hesitancy for fitting adults? And if so, how did you get past it and move on to start doing, adult Ortho-K?
Actually, no. I was probably more the opposite. I probably should have been more squeamish,
Okay.
because kids, if they come in seeing 20/30, they think everything's great. If an adult comes in seeing 20/20, but there's something weird about their vision, they're going to tell you about it. They're going to let you
Mhm.
know, and it's a very different mindset, I guess.
Mhm.
And Yeah, no, I have patients who are, airline pilots. You can't mess that up.
Right.
That's you probably want to be a little bit cautious, and you want to be conservative in some of these things. And so, um, yeah, no, I actually was very excited to get started, and some of my first patients as well were. Actually, before I really went all in with Ortho-K, were some Ortho-K patients who moved into the area, and I kind of picked up their care. Um, and so, yeah, no, totally different animals, adults and kids in that regard. I have worn Ortho-K full time myself, probably 5 or 6 years, I guess.
Mhm.
Can't remember exactly when I started, a little pre-pandemic, but um, and actually that has been a journey in itself. My first exposure to Ortho-K as a patient was back in optometry school. I didn't know anything about it, hadn't heard anything about it, but a resident wanted to get a little bit more experience with it, and I volunteered, and it went so bad. It was a disaster. I think they were pretty new to it, and what I didn't know at the time was I have kind of some weird corneas. Other docs have kind of asked me when they see my topographies, do you have mild keratoconus? What's going on there? Like, and so I think really my eyes were the reason for the failure back then. But
Mm.
since that time, and as I've gotten to get into it, it's become a real kind of blessing in disguise, because I can be my own guinea pig. I
Right.
can experiment on myself without experimenting on patients, and that really has helped me learn a lot. I think I've lost count, but I think I've had over 100 Ortho-K retainers, either I designed or someone designed for me, and I've worn, and it's just a tremendous experience. You try things, and some things are pretty conservative, some things are pretty aggressive. But with the technology that we have, and we can make free form lenses, we can decenter optic zones, we can do so many cool things, and a lot of them don't work out the first time. And so I think a real benefit to my patients that I've tried this 3 or 4 times to get it to work before I ever bring it to them. And I have dealt with the bad vision for a couple weeks or a month or whatever, so they don't have to. And you take
Yeah.
those learnings, and it's that's the kind of thing that's really not that important for kids in most cases, but for adults, especially when you're doing multifocal correction, especially when you are treating a lot of astigmatism, corneas that are outside the norm. It's been a really fantastic experience for me, and I love it as a patient too. And
Yeah.
so, yeah, it's
It, it gives you that
there's
relatability, right? Like I'm an
the
Ortho-K
relatability, the
wearer.
empathy.
Yeah.
Yep.
I'm a later in life Ortho-K wearer. When you were talking about your corneas, I've had similar responses, like around the keratoconus aspect of it. There is a certain advantage, don't you think, to being a wearer, and also speak to this as well, because you mentioned like 100 or so retainers that you've gone through. Explain the value of that level of, you just didn't get it right. You went through that many tries. How does that aid you in your practice specifically? Because I think that's a great point. A lot of people listening to this or watching this would be like, "Oh my gosh, 100 or so attempts," and that would frighten them. But you've used that as a learning experience, and I bet it's helped you in how you've been practicing Ortho-K and myopia management. So let's talk about that. What kind of advantages are there from going through that many trials?
Yeah, no doubt. And I guess I'll say a couple things. One is my good friend Adam Ramsey has a saying that he talks about a lot, and he says, uh, "We don't fail. We either succeed or we learn." And I really internalize that. I think it's a really smart thing. Um, but the other thing is, I also hope I didn't misspeak and say that all of those 100 were mistakes, or that it took me 100 tries to get where I wanted to be. Many of them were intentional. So, meaning I would get a retainer made that was much too tight on purpose, and I would wear that for a week because that feels different than a retainer that's much too loose.
Mm-hmm.
And when a patient comes in and say, "Oh, I have this pinching feeling, or I have this, or I have that," now I can think back and say, "Okay, well, actually, I kind of already know where we're going here because I know exactly what you're talking about." And I've made retainers with excess central touch, which is not something you ever try to do. And all these different things give you a unique experience. Because every different fit type has a different feel. Every different mismatch on the cornea produces a different result. And so, especially with, I know we're going to get into topography a little bit and some details and nuance there, but so much of what we learn on the base level is just, okay, do you have a smiley face pattern or a frowny face pattern, or is it centered? Well, there's just so much more to it than that. You can have a perfectly centered molding pattern and still have a lot of residual. So you can have a perfectly centered molding pattern and still have some irregularity in the visual axis. And so knowing what all those things look like, sometimes you'll see a pretty easy 20/20, but you notice one eye sees much worse contrast than the other. And all of these different little bits and pieces, again, I think make me a better doctor, make me a better prescriber, because I'm not sitting and scratching my head when somebody says, "Hey, this is happening." I say, "Well, actually, I know exactly what you're talking about, and
Yeah.
here's how we fix it." So yeah, I consider myself, I guess, mid-career,
Okay.
and I'm proud of how much I've learned, how much I know. But oh gosh, it's just accelerating, and I'm so excited about what we'll learn next, where we'll go next, what we'll be able to do next. I think to go back to something I've heard from Carey, he put a pretty big stamp on me in that, just the concept that, our biggest limits are in our minds.
Mm-hmm.
You know, if we can imagine something, we can do just about anything with Ortho-K that we can do with soft lenses and more.
Mm-hmm.
And it took me a while to honestly believe that, but I think it's absolutely true. And I think, again, that, um, that our imagination is the only thing holding us back sometimes.
Right. Speak more to that too, because that's such a great point. A big part of this podcast is helping, or at least trying to help the practitioner get out of their own way. We are often our own worst enemy. When you started the podcast with what you said about me, I was blown away by it because I don't know if I would have ever gotten to the myopia mindset as a project because I put all sorts of obstacles in my path. I'm not an optometrist. I've never designed an Ortho-K lens. I was primarily working from the staff perspective. I did do some consultation once I got to Johnson and Johnson, but I had to learn all of that in a short period of time. And I just didn't have enough faith in myself to be able to speak to myopia management confidently. And also, I didn't think I'd be a credible host to have somebody like yourself on the podcast. So, let's talk about that. Like, what kind of obstacles were you putting in your own path? And how can we help the listener kind of get out of their own way and realize their potential?
Well, I think a really important paradigm shift for me was, you know, I think traditionally I've generally thought that most things have been figured out and you just had to find the right book to read about them. You just had to find the right person to talk to, and they would give you the answer. And I mean, maybe that's true for some things, but when you are doing something that is relatively new, in the big scheme of things. I mean, obviously Ortho-K has been around for decades, but, um, doing custom software design is newer, and all the time they roll out new features and new abilities and things like that. Some of these things, it's upon us to figure them out. And once I kind of took that mindset on, this is not something that anyone's done before. This is not anything that somebody can tell me necessarily, maybe bits and pieces of it. But when I took the role of more, okay, I'm going to be the one to figure this out. I think that really changes a lot. And I certainly know, a lot of people have that imposter syndrome. They feel like they're just not good enough. And most of the time it's, well, nonsense.
Right.
Sometimes it's the most capable people. Sometimes it's the most qualified people that feel like they're inadequate. And that's, I think everyone experiences that occasionally. Some people certainly more than others. But yeah, I think, if we can just put ourselves into the mindset of being, not only can we do things that are bigger and better than what have been done before, but we almost have a responsibility and a duty to keep pushing this forward. And, if we only do what the previous generation has ever done, progress stops. Like that,
Yeah.
that doesn't work. So
That's a great point.
yeah, we really kind of have a duty to, walk that line where, we never want to be too aggressive with patients. We never want to do things that are unproven or untested. But we also don't want to be so conservative that we do our patients a disservice either, because I think there's a huge risk of that too. It's a fine line to walk. Fine line to walk, I should say.
Yeah, yeah, definitely. And I think you bring up a bunch of great points. One of the things that you said that really stuck with me was, you mentioned imposter syndrome. And I wonder if the only people who are experiencing imposter syndromes are the people who are not the imposters, right? Because it represents a sense of self-awareness. You are very hypersensitive to the fact that you don't know everything, and that Ortho-K and myopia management has so much complexity to it, and there's so many different aspects to it. I feel like the person who that doesn't matter to is not having the thoughts of imposter syndrome. They're just being like, well, none of that matters. I'm just going to go ahead and either write this off or start making mistakes because I don't have the self-awareness to question whether or not I belong here. Would you agree with that? That maybe that is an underutilized core function of a myopia management practitioner, right? They have the self-awareness to recognize that they don't know everything, and that's a problem for them. That might be a critical, touch point. Would you agree with that?
I think you nailed it, and I think that's half of it. Of course, when you are comparing yourself to others, the part about yourself is important, but I think the part about others is important as well. And I think that in a lot of cases, we greatly overestimate what everyone else knows. And we think, well, everyone else has the answer. Everyone else is confident about this. And I think that's rarely the case. I think if you could get inside someone else's head, they're probably just as uncertain. And, being able to comfortably manage uncertainty is really, I think, one of the best traits a doctor can have.
Yeah.
Because, if you don't know the answer, that's fine. Maybe no one else knows the answer either. But if you know how to find the answer, if you know how to take care of the patient until the answer presents itself, that's really the key to success in these high level decisions and cases.
Right. And what has been your process? Like, I'm sure there's been a case you've come across, or, a particular patient where the fit just wasn't going the way it was supposed to. What is your part of that process where, like Kerry would say he had some cases where he was like, look, I don't know why this isn't working, but I'm not giving up, And I feel like you have a similar aspect to who you are. So what is, how do you handle those difficult cases when you run up against a wall? Because man, Ortho-K specifically, but really all of myopia management is that rabbit hole within rabbit hole kind of thing. I remember cases where it's like everything looked good in the first 2 weeks, and then all of a sudden treatment started. I don't want to use the term degrading, but I don't have a better term off the top of my on the tip of my tongue, but it's like we just weren't getting that initial result for whatever reason, and we really started scratching our heads about what is happening with this lens. Why isn't it fitting the way it's supposed to? Why were the initial results so good? So what is going through your head? I mean, obviously, you've done a lot of fits on yourself. You've learned those particular aspects. You're keyed into what your patients are telling you. What goes into your thought process when you kind of run up against an obstacle or a wall?
Sure. Well, one of the reasons that I love Ortho-K is just because I honestly think it's the hardest thing that we do in eye care. There are just so many different aspects, and you kind of need to do a great job with all of them or most of them most of the time. And so one of the trickiest things that I can think of is when a patient comes to you with an Ortho-K fit that is so-so. And, I think the initial temptation is to think, oh, this is an established patient. This should be easy. They already know what to do. They already know so much about it. They're already fit and doing okay. I'll just make this a little improvement and they'll be doing great. And that is so often not the case. It is so hard to jump in midstream sometimes and take over somebody else's work. Even more so if you don't have their baseline topographies and you can't see where they were coming from. And so, to be honest, I've spun my wheels sometimes, and more and more when that situation presents itself, my take is that we probably should just start over. Wash them out, take 2 weeks, take 4 weeks, whatever it takes. Even investing 4 weeks right now may not be the most fun thing for them, but oh boy, there's nothing worse than spending 3 months trying to get something right. And you're, like you said, sometimes you just don't have all the information. You can't know the answer, and you take your best guess. You make your most educated change, and it bombs. And so, yeah, if you start fresh, you at least have all the information. You're starting from square one, and it takes a little bit more work on the front end, a little bit more effort. But I more and more have gone to that as a troubleshooting option. Right. And yeah, certainly there are many other factors. You can't follow somebody home and know how they sleep. You can't know if they sleep with their eyes open. You can't know if they sleep with their knuckles dug into their eyeball, or on one side or the other. People are not always completely honest with you. When was the last time you missed a night in your retainers? Kid says 2 weeks ago. Mom says last night, 2 nights ago.
Yep.
And so, if you're not asking these questions, if you are, not really probing every single aspect of it, you can really easily overlook something that's really important. And it may have nothing to do with your abilities as a prescriber. It may be some lifestyle thing that you just didn't think to ask about. I could go on with all the things that you hear and all of that.
Yeah. I love it.
As many people as there are, as many patients as there are, that's how many different things can happen.
Great point. Yeah. I mean, I sleep on a wedge pillow for a couple of reasons. It helps reduce snoring. It helps me get a better night's sleep. It's better for me to sleep on my back. It's better for my Ortho-K wear. And if I'm sleeping in like a hotel room and I don't have a wedge pillow with me, I notice a difference in my vision after multiple nights of sleeping like more on my side, or like when you mentioned digging your hands, I'm like, man, I've done all of these things. So I think those are great points. Part of your philosophy, what makes you very special in this space, in my opinion, is your devotion to preventative care. And we've already gotten a little glimpse of that in the, number of retainers you've already had fit on yourself, and how you've gotten keyed into those like experiences that's helped you, relate better to what the patient is telling you and improved your fits. Let's go more into your mindset about preventative care and how that's become a core part of your practice. So when did you start getting into preventative care, and what does that mean specifically for Ortho-K and myopia management?
Yeah, absolutely. I mean, no question, it's still evolving, but I have 3 kids, and certainly becoming a parent changes a lot of things. And it really makes you prioritize different things. And, in terms of systemic health, you start thinking about, well, do I need life insurance? You start thinking about, my cholesterol's not that bad, but is it really where I want it to be? All these things are going to matter at some point. And, the eyes are no exception. You know, Imagine, if we've ever had a grandparent who just couldn't see us. My grandmother had macular degeneration, and, so much of my childhood, I didn't know her as a seeing person really. And, I can't even imagine what kind of impact that had on her. Um, I think when we are short-sighted, we wait until there's a problem and then try to fix it. And I think that's one of the worst things about our healthcare system. Certainly, we've talked offline about, books and things like that are written on that theme. But yeah, I mean, if you make a little change today, it can add up to a huge change. It's the compounding interest of healthcare.
Right.
When you do little things right today, it makes everything better in 20 years. It makes everything better in 30 years. It means you can see your grandkids. And, it's so hard to get people out of the mindset when it seems like everything's okay. Well, I just put on my glasses, I can see fine. Well, I mean, yeah, that's good. That's great. But we want to keep it that way. We want to make it so that that doesn't change. There are a lot of people that put on their glasses and still can't see. We don't want that for you patients. And so really internalizing that, really thinking about that, I think, helps me bring that to clinical care. But yeah, the older you get, the more you can see, okay, what if this is my kid sitting in the chair?
Right.
And you've seen, people with retinal detachments, you've seen people with myopic maculopathy. And another tragedy of myopia really is that, macular degeneration traditionally, and, glaucoma and some of these big things that we think about, these mostly become severe, in our 70s, 80s. Myopia, it can get pretty severe in our 40s and our 30s, even for some of these people. And, when you think about the difference, spending half your life with visual impairment, that it kind of puts a whole new spin on everything. And like so many things, you can prevent it, but once it's there, you can't reverse it. You can't undo the damage. And so it really does take a lot of effort to, impress upon people that, hey, I know it feels like everything's okay now. I know this feels like this is not a big deal. But here's what could happen. And to do that without scaring them. You never want to threaten people. You never want to, make people feel terrified. But boy, there's a lot of nuance there. And a lot of things, it can be both.
Yeah, there is so much nuance there, right? Because not only do we not want to scare the parent, right? That, like, I have been in practices where they're like, what kind of information is out there? Because I really want to shock this parent into realizing how important this problem is. And I'm like, well, let's stop right there. We do not want to scare the parent. We do not want to put that parent in a position where we have a negative exchange with you and them, because best case scenario then is they take you seriously, but they have a negative encounter with you. And I don't have any statistic to prove this, but I feel like that makes them more likely to go to somebody else, because they want them or their kids to get taken care of. They don't want this adamantly negative punishing attitude from their from their optometrist for sure. We have so many aspects of this problem, however, because we live in a world where, I mean, like I've said it before, I'll say it again. I was a smoker for 15 years. The healthcare provider that was most interested in helping me quit was my dentist, not my general practitioner, who I did eventually fire. And when it comes to issues of like being overweight or exercise or getting outdoors, there's a huge amount of hesitancy in modern healthcare to even talk about these issues because there's a lot of different reasons around that, right? So how do you have those conversations with your parents? We're not trying to scare them. We are trying to enter into these elements of visual hygiene and why they're important. We're also dealing with this problem of some parents being like, well, so you're saying that this could affect them later on in life. I'm just trying to get my kid to karate practice, get them to do their homework, and then get them to bed and get them to school the next day. I don't know if I'm thinking about when they're in their 40s or 50s. So run us through your technique. Like, how do you have this conversation with your parents?
Yeah, no doubt. I really love the communication aspect of it. I have become more and more aware and try to actively seek out examples and ways of learning how people communicate. When I say something, do they really hear this, or do they hear something else, or is there a better way for me to say this? And so one thing I really love is Justin Kwan and the Cooper Vision team boil it down to, hey parent, I'm concerned about this, but there's great news. We can do this. And I think that beautifully expresses really the whole thing. And then, of course, yes, you open it up for questions. You start talking about, how serious is this? What do we do if that? Whatever. But I mean, I think that's it puts a beautiful bow on it. I'm concerned, but there's great news. Here's what we can do. And I think, at the end of it, that tells them everything they need to know. If they're only going to remember, a tenth of what you tell them the next day, I want them to remember that.
Right.
And so that's really where I try to put my focus. I think all of us have the tendency to be a little bit too verbose and, talk about technical aspects and the physical optics and all these different things. And I mean, that's great to talk shop, to a podcast of optometrists, but not in the exam room, not with patients, not with parents. I really like the idea or the concept that, a really intelligent person takes a very complicated, complex situation and makes it sound simple. And a fool does the opposite.
Right. Yes.
And so I don't always succeed at that, but at least that's in my mind and that's a goal.
I definitely want to close on that. I'm inspired by working with doctors like Andrew all the time. And, whenever Andrew and I sit down, we talk for, well over an hour on all sorts of things in life, not just myopia management, but we talk a lot about that as well. And Andrew, I hope you'll come back on the show because I can think of a variety of topics I would love to have you on to talk about. You're
definitely
definitely
one of
the rising stars in our industry. You're part of that new generation. There was a while there. I'm always hesitant to admit this, but it's the truth. There was a little bit of time there where I was a little concerned about the future of myopia management because there was, what I'm used to in that pioneer generation. And I just wasn't seeing enough of it replicated in the newer generation. And I think there's all sorts of contributing factors to that, from student debt to how difficult it is to get your own private practice and or to take over an existing practice. But my heart is definitely set more at ease with doctors like yourself, part of that new generation who is picking up that baton and doing it in the way that, like Kerry has done and so many others of his generation. So definitely keep up what you're doing. You're an inspiration to all of us. And I cannot shout that loud enough from the highest mountaintop of figure out who you are, who you want to be as a practitioner. This is what Andrew's done. There's so much as a part of that process, and really getting into that genuine authenticity, I think, is super important which Andrew exudes. He is the definition of genuine authenticity in this space. And I think it really aids you in your practice. And as a fitter, as a myopia manager, I think it really helps you and defines you and has helped you along your path. So thank you so much for coming on to the podcast.
I am so honored. And we'll talk anytime you want to talk. One last tie-in, I think, to what we talked about earlier. So if it is true that innovations in healthcare take 17 years to become mainstream, I believe that Earl Smith's landmark paper about peripheral defocus and myopia came out in 2009. And so 2026 is our year.
Yes.
Hang in there. We're going to try to accelerate this thing and make this not so niche anymore.
Yeah, I would love it. I've heard for years people have said, this is about to blow up. When I was running Vision by Design, people were like, get ready. You're going to have thousands attending Vision by Design. And it didn't happen. Maybe 5 years isn't enough time for that to happen, but everybody was like, this is blowing up. This is going to get even bigger. And I've really been struggling with that idea because we just haven't seen it. So very encouraging. If anybody has any questions for you, wants to reach out to you, is there a way for them to get in touch with you online?
Sure. Certainly look me up on Facebook. We talk on all the provider forums there. If anyone wants to email me, shoot me an email at c@icaredupage.com, just SEE and the practice name. Happy to talk to anybody. Love talking through things with people. And because I learn a lot when people ask questions too. So, thank you so much for having me, Matthew. Always a pleasure to talk to you. I really appreciate you and everything you do for our industry.
Same. So Andrew, I can't wait to have you back on. For everybody else, we'll see you at the next one. All right, well, that's it for this regular version of the episode, but the discussion doesn't stop here. It actually continues in an extended version of this episode, which is available to our Substack supporters. You can, if you're interested in getting the rest of the episode, consider becoming a paid supporter of the Myopia Mindset. In addition to an extended version of this episode and every other episode that we do, you'll also get access to exclusive monthly bonus episodes of the Myopia Mindset. And I know you're interested. You've made it this far. And for the cost is $12 a month, which is basically the cost of a cup of coffee each and every week. And that's how I like to put it. Listen, if you would buy me a cup of coffee each and every week to nerd out about myopia, to bring on amazing guests, to spread the word about how awesome myopia management is and how more ECPs should be engaged in this specialty, then please consider becoming a paid supporter of the Myopia Mindset. You can do so on our Substack. myopiamindset.substack.com is how you do that. Thank you so much for your consideration. I'll see you at the next one.